Hi, I'm Kathy with NurseWorks in association with Tropical Pine Tree. Today I will be giving a basic lesson on lung sounds. The two things I will be talking about are crackles and wheezes. Before you actually use a stethoscope, you need to observe with both your eyes and your ears for anything out of the ordinary, such as the use of chest muscles, audible wheezes, paleness, redness, cough. Doing an O2 stat test is valuable as well. After you have done these things, it is time to listen to the lungs. The two lung sounds I will be discussing are crackles and wheezes. Crackles sound like crispy rice cereal, and wheezes are described as musical notes. How do you tell whether these sounds are acute or chronic? Here's the example of the cycle of respiration. Here is the inspiratory phase, and then here is the expiratory phase. By the placement of the sounds, you will be able to tell whether the crackles present are acute or chronic when you hear them. If you hear crackles in the early inspiratory or early expiratory phase, these sounds are acute. Conversely, if you hear crackles in the late inspiratory or late expiratory phase, these sounds are chronic. Many times you will hear crackles in both the early and late phases. This is a signal to you that there are two conditions residing at the same time. For instance, if you have a patient with C.O.P.D, you'll be used to hearing crackles in the late phases. But if one day you listen and you hear crackles in the early stages as well, you will know their condition has changed and it is time to investigate. As they are treated, you will notice a decrease in the acute sounds. This is one signal that they are improving. Wheezes are the sounds you hear when air is being constricted in the bronchioles. Wheezes are differentiated by the amount of sounds you hear. Acute wheezes present as one or two notes. Chronic wheeze will present as a many-tone orchestra. When you chart, you need to put down accurate information. Remember, this chart will be what the doctor sees when they walk into the facility. You will also be using this information when you call in a change of condition. Upon your report or the chart, the doctor may give orders for labs, sputum cultures, blood gases, chest x-rays, CT scans, or even a pulmonary function test. Medicines may also be dispensed upon the information you have collected. It is important to write concisely and accurately. Thank you for watching our video. Please subscribe and like us. You can visit us at our website, www.tropicalpinetree.com, or you can also become a patron of our site. We also have other blogs that may interest or help you as well.